Hello, and welcome back. On to our next virus in the picorna family, Coxsackievirus. Normally, we at Sketchy Micro like to go with really obvious associations so that you can immediately recall the scene tied to that bug. So I'm going to ask you, what's the first thing that comes to mind when you hear the word Coxsackie? Right, well, our scene's not going to be about that. Instead, it's going to be about cockatoos. Maybe a little less obvious, but a hell of a lot more politically correct. Like our poliovirus, Coxsackie is going to take place inside an aviary. Remember that Coxsackie is a picornavirus, so the cockatoo has its Pico baby counterpart right here. Notice the yellow and orange warm colors, which signify that it's an RNA virus, and the sun that you can see through the bars tells us that specifically it's an RNA positive virus. Another general feature that you should know from the overview is that Coxsackie is a naked virus. So let's add a statue of David inside one of the cages. Okay, the two cages are labeled A and B to represent the two flavors of Coxsackievirus. Although they're both pretty similar in their presentation, there are definitely some distinct differences between the two, which we'll go over. I just want to add that we are a visual learning system, and just writing letters like A and B might not seem very visual. But notice we have A to the left and B to the right. Anytime we have anything in sequence, it'll always be oriented from left to right, because that's how we read. So when you're thinking back trying to recall which is which, you may not remember the A and B, but you should remember which one was on the right side and which one was on the left. I just wanted to make sure you're aware of that. So for now, let's focus on cage A. In cage A, which is for Coxsackie, we have our friend David, and we'll use him to represent the most important clinical feature. We'll add some red birdseed to the statue and have cockatoos pecking away at him. Notice his mouth is wide open and there's a bird pecking at his mouth. His hand is outstretched with another bird eating out of his hand. And if you look at his feet, there's a ton of birdseed and some bird pecking away at that too. So all of this red birdseed and pecking is to signify that Coxsackie is associated with hand, foot, and mouth disease. And we made the birdseed red so that you can remember that it's a red vesicular rash. What other microbes cause rashes on the hands and feet? It may be tricky to think back, but remember syphilis and the astronaut with red gloves? And our rickettsia rock climbers that are getting a rash on their hands and feet from the rock wall? Okay, so that's hand, foot, and mouth disease. Next, we're adding a kid watching the birds with a space helmet on. I shouldn't have to tell you what this represents, but it's our meningitis helmet. And remember, viral meningitis is also termed aseptic, since there won't be any bacteria on gram stain. Coxsackie infections most often occur during summer months, so we'll add a little girl here in a bathing suit to help you remember that this is summertime. I always had trouble keeping the season straight for various viral illnesses, so hopefully this makes it pretty easy. Okay, let's move on to our Coxsackie B cage now. We can see lots of bags of bird feed in the cage, and these bags are very loose and floppy. And if you look closely, the bags are shaped like a heart. So this is to represent that Coxsackie B can cause a dilated cardiomyopathy, which is represented by these floppy, dilated, heart-shaped bags. It's a pretty devastating sequela of Coxsackie B infection, and is a highly board-tested aspect. Additionally, if you want to take your Coxsackie knowledge to the next level, there's one more thing that we want to include. We'll add a zookeeper reaching in and grasping the cockatoo by his chest. Notice it looks like the cockatoo is pretty uncomfortable with this. This is another clinical feature of Coxsackie B called the devil's grip, also known as Bornholm's disease and pleurodynia. This devil's grip is often characterized by extreme sharp pain in the lower chest and is often unilateral, and this often makes it very difficult to breathe, hence its other name, pleurodynia. Pleuro, referring to the pleura of the lung, and dynia from the Greek word for pain. So to recap, we have two bird cages, A and B, for Coxsackie A and B. Cage A on the left, illustrating hand, foot, and mouth disease, and cage B on the right, illustrating dilated cardiomyopathy and devil's grip. Don't worry about the treatment, it's just supportive. So you'll be expected to know more about the general characteristics and clinical presentation. So that's all for Coxsackie virus. Let's continue on to the rest of our picornaviruses.